You know, people with mental illness are just like you and me. At the end of the day, what they want for themselves is the same thing that we all want. Schizophrenia is an illness that affects the brain's ability to process information. The concept of cognitive enhancement therapy is that the brain has the ability to develop new neural pathways, new connections.
Schizophrenia is kind of like losing some real important years of your life. So you feel like you're always behind and you didn't get something that other kids in school got.
I do suffer from schizophrenia. I've had it since I was about 13 or 14 years old, and I'm 30 right now, so I've had it for pretty much half my life, and I feel like it's helped me out a lot and deciding, because I'm learning about different parts of the brains and how they function and work with each other. When I was first diagnosed, I had a lot of anger issues, and I'm noticing that the CET program, I'm able to think more positive, more clearly, so that way I don't get angry all the time and lash out on people.
And for so many of these members, I think that they had kind of reached a point in their lives where they had maybe gone as far as they could go, that there wasn't anything else to do. They're on the best medications possible, they're as stable as they can be on these medications, but what else is there? And I think what we're understanding from the CET is that potential is not gone. Every bit of it is open-ended.
We've got something now that will address the very things that have really kept people with schizophrenia from really participating in life.
We're addressing their thinking, their emotions, and their social skills. And all those activities kind of wear their brain out in exactly the area where it needs to be.
For certain reasons, I have lost a lot of my ability to remember certain things, short-term and long-term memory difficulties. I've been told that I'm a lot better in certain ways. I think that maybe before CET I wouldn't have been, I don't think I was as motivated. I believe it's challenging, or I wouldn't keep coming back.
Yeah, is it a slow change? Absolutely, but every week we see little changes, and I think that's been really exciting.
They're accomplishing things that they didn't think that they could accomplish before, whether that's going to school or getting their own apartment.
I've gone back to school since it started, studying computer-aided design at Jefferson Community Technical College. It helps me to be able to follow what the teacher's saying and be motivated to do the homework. I think I'm just going to really be improved.
It's helped me with my attention span, and it's helped me ask the right questions to people and get a better feeling of what their perspectives are and what they're feeling at the time. Me and my brother, we never got along until now, and I think here lately, since I've been coming to Bridgehaven, so that's been a big help. I'm looking forward to seeing what else I can improve on.
It's a little bit devastating. It's something you can't plan for, and I wanted to make sure that I had a clean sheet. I didn't want to have any mistakes on my record. When you're around a lot of people that are like the same age as you and they have the same diagnosis, then it makes it easier.
Outside of the community, they don't get it, but we members get it. We understand one another. Well, we're like a football team or a basketball team. We root one another on. We want the best for each other.
In some ways, schizophrenia is a degenerative disease, and so we have stopped that degeneration and in fact opened up the development of those areas of the brain that help people to hold jobs. This individual now has a much greater chance of living what we would see as a normal life.
Bridgehaven has always been a pioneering organization, has always been one of the first to implement new evidence-based practices into our program, and we are extremely proud that we are the first in Kentucky to offer CET to our members and to other people in the community who can benefit from this service.
I think you could take all of the people that are in CET right now and just say, we said to them, okay, this is as good as it gets, let's put the lid on, and you just stay stable and stay out of trouble, and you don't get in our way, we won't get in your way. And now we're saying, no, open that lid, you can do anything you want, anything is possible. So, I think we're funding hope with what we're doing.